All right, why don't we go ahead and get started? We'll do just a little introduction of myself and the center first, and then we will talk just a minute about WebEx and making sure that everyone sort of knows how to navigate the system before we get started. So, Karen, I think you are recording. That is awesome. Um, I just want to say, hey, first, thanks for joining us on today's webinar about the Positive Culture Framework. I'm excited to tell you a little bit more about the framework that we use at the Center for Health and Safety Culture to improve health and safety. As some of you know, my name is Katie Dively. I am a senior research scientist at the Center for Health and Safety Culture and also a trainer. So mainly I train groups in the framework, and then I also serve as a guide for communities or organizations who are looking to implement the framework in their work to improve health or to improve safety. And you'll see that we do that in a number of different ways, a number of different topic areas. So let's get started with just a couple of tips on WebEx. As you heard as you were joining, there are some new functions in WebEx. This is WebEx webinar, so that we were just kind of testing out there. We are recording today's webinar, as you heard, so we will be placing that recording on our YouTube channel, which we do with all of our previous webinars. So if you haven't done that, you can certainly go to our YouTube channel, Center for Health and Safety Culture, and check out archived webinars that we've done over the years. So if you have colleagues or coalition members that you want to have watch, they can certainly check that out. If for some reason you want to change your audio, you can do that. So you might be joining now with your computer audio, and if you need to switch to your telephone or for some reason you lose connection, you can click on the three little dots at the bottom of your screen and it will bring up a pop-up where you can select Connect Audio. And from there, it'll give you a couple of different options. You can either dial in to the webinar. You can have the WebEx system call you, which is actually much simpler. You just put in your telephone number, or again, you can just use your computer's audio. Another aspect of WebEx that I do want to point out is that chat feature. So you can pull out your chat window. If you do have a question or you do want to put a chat in there, please do. But if you don't mind putting that to everyone so that we can see, I will look at those throughout the webinar. I will, if I can answer something during the webinar, if it fits right in, I will do that. Otherwise, we will have an opportunity at the end to ask questions as well. So I might hold some of those until the end. We will have time for that. If you are having any kind of technical issues here, if you wouldn't mind reaching out to my colleague, Karen G, who is on the phone, she can kind of help navigate some of those technical issues. So maybe just put a chat or a question directly to her. I think that would be great. She's my co-host today. And then if for some disastrous reason I lose my internet, Karen will take over the slides and I'll just call in. So just be patient. We will get reconnected if something goes south. Hopefully it doesn't. So just a little bit of background on the Center for Health and Safety Culture, the organization that I work with. So the center is located at Montana State University. We're an interdisciplinary center. We've got a wide variety of backgrounds. My background is public health, but we have engineering and social science and psychology and prevention science all coming together to conduct research on how culture impacts health and safety. We conduct very applied research, and it's always sponsored by, in partnership with either a community or a state or a tribal organization or a national organization who's looking to improve health and safety in some way. So all of these groups are looking to make some sort of meaningful impact on the lives of their community residents or even their employees, because we work with work sites as well. Our work predominantly covers these areas: traffic safety, the misuse of substances, violence, and child well-being. As you know, these are really big public health issues. They're the leading cause of years of potential life lost, but they also overlap quite a bit too. These aren't sort of separate or isolated issues. We know that the misuse of substances has a profound impact on traffic safety. Likewise, violence and child maltreatment are impacted by the use of substances. They're really all interconnected. And our goal at the Center for Health and Safety Culture is to really study them. How do they connect with one another? and honestly find an overall approach that transcends any of these issues that you guys might be working on at your local level. So here's what we're going to be discussing today. We will, of course, be looking to answer the question, what is the positive culture framework? We're going to start actually by describing what we mean by framework and how that's different than a specific strategy that you might be engaged in. Then we'll discuss what we mean by culture, how we can operationalize this sort of at the community level or even the organizational level. And then also, why do we intentionally work from a positive frame? Sort of what are the benefits of that? And towards the end, we'll bring it all together and introduce the positive culture framework as a way of organizing our efforts to improve health and safety. And you'll see that it is a broad framework. We can really use it in multiple topic areas. So before we get started, what I would like to do is actually just open up a poll question for you. I would like to know at this point in your work, give me just a second, I need to find the poll. At this point, hopefully you've seen it pop up on your screen. Do you currently have a framework or a process that guides the work that you do? Do you work within some sort of like planning framework or planning process that guides the work that you do to improve health, to improve safety? So go ahead and click either yes, no, I don't know. What I'll do is I'll close the poll and then we will see everybody's responses. So I'm going to close it, and it takes just a second. Hopefully you can all see the results here. We had 8 of us saying, so about 67% saying, yeah, we work from a framework, we work from a process to do the work that we do. 25% saying no, that they don't. So that's good. You know, some of us, many of us really are using some sort of framework to guide our efforts at improving health. And this is important because a framework or a process can really help us be more effective in the work that we do. So let's start thinking about a framework and what it is. And in order for us to talk specifically about a framework, I really do want to talk about the difference between a framework and a program or strategy. We really see a framework as a way of organizing the work that we do, and that it's different than a program or strategy. And I'm going to use the word program here, but it could mean strategy. It could mean countermeasure if you're working in the traffic safety arena. But I mean the same thing by program, strategy, or countermeasure. So a specific program or strategy is really specific actions that are addressing a specific behavior. So you might be implementing a curriculum to reduce underage drinking. You might be looking at passing a specific policy to reduce distracted driving, right? So it's a specific action that you're taking to address a specific behavior, right? Underage drinking or distracted driving. Maintaining fidelity to those actions, right? Implementing that program or that strategy with fidelity is incredibly important so that you achieve the same outcomes that maybe the program developers achieved as they were evaluating the program. So that's a program or a strategy. You probably are all engaged in some sort of program or strategy. Now, that's a bit different than a framework. A framework we really see as a way of organizing the work again. We have a generalized process that we use. We have a 7-step process that I'll highlight in a bit that we use to sort of plan our work. Within that 7-step process is a step about the selection, the identification and selection of your specific programs and strategies, right? So they fit in to the framework. We believe that critical skills are necessary to implement the framework. We'll talk about 3 critical skills. And quality of implementation is really important. How you engage in implementing the framework, how you engage in that 7-step process absolutely impacts your outcomes. So quality of implementation matters. And I really just wanted to draw out the differences between a program or a strategy and the framework, because I often get the question, about the positive culture framework, or the comment even, the positive culture framework being a strategy. And it isn't. It is a framework that you can put strategies into. So when we think about the positive culture framework, again, I'm just reiterating, we do see this as a way of organizing our work to improve health, to improve safety. We see it as very broad in nature. You'll see that as I go through a couple of examples, and it can be applied to a wide variety of contexts, right? Different groups, different kind of populations, also to a wide variety of issues. And that leads me to the core idea here. We really need to be thinking about our work about both being about the content that we're working on. So again, maybe it's impaired driving, maybe it's violence prevention, maybe it's improving mental health, but also the process for doing the work. And I think sometimes we can get stuck only in thinking about the content, and content is very important. Yes, of course, but so is the process for engaging in and for organizing the work. When we focus on the process, we can apply it to other issues that we work on it as well. Because I almost doubt that there's any of you on the phone that only work on one single issue. You're probably working on multiple issues. So let's go back to the agenda here. We've talked a little bit now about what we mean by a framework. Now let's talk a little bit about what I mean by culture. And before I jump into some of the specifics on culture, I think we recognize that if we don't create changes in behavior, health and safety isn't going to improve. And it's for that reason that I want to show you on the next couple of slides a simplified version of a behavior model, because it really requires changing behaviors to improve health or to improve safety. So this is a very, very simple behavior model that we use at the center. Of course, we're looking here at changing the behaviors of individuals. We want to grow healthier, safer behaviors. And I will say something to think about is that it's not just the behaviors of the people who are engaging in the risky behavior that we want to focus in on. It's other people as well. While I might want to reduce impaired driving, right? Individuals who are drinking and driving. What about the behaviors of alcohol retailers? What about the behaviors of policymakers in my community or key leaders in my community, right? There are many behaviors that we want to address for that issue. So at the end of the day, it's really about changing multiple behaviors. So let's look at this model. Behavior being on the far right, and that's any of those behaviors that I just mentioned, right? This can be any behavior that we're looking to shift. It could be the behavior of our coalition members to engage more. Let's look at what's driving these behaviors. So these intentional behaviors are coming from a variety of values, of attitudes and beliefs about the behaviors. And these values, attitudes, and beliefs then create sort of a condition of willingness or intention to engage in that behavior. And I get that this is very, very simplistic. There's a lot more to this that we go through in the full positive culture framework training. But the point is, we need to know a little bit about behavioral science if we really want to engage in the work of behavior change, right? And again, that's really what this work is about. It's about growing healthy, safe behaviors. This is a much more complex version of a behavior model that I just showed you. This is what we use at the center when we start to plan surveys or start to plan projects. It's not as simple as the previous diagram. There are multiple beliefs that we want to address, but nonetheless, I think it's important that we start with a simplified version of the model. So again, if we see that our work is about changing behavior, then our work really needs to be about changing values, attitudes, and beliefs that start to change willingness and intention to engage in a behavior. So let's start on the left with values for just a second. Values are pretty broad in nature, and they aren't tied to a specific behavior. Like, I don't have a value system about wearing a helmet when I ride a bike, but I do have values around health and around safety. So they're more broad in nature, and they're pretty slow to change. They may change sort of over a lengthy period of time. What we really want to do around values is we want to connect people with values, which are often pretty protective, and leverage those values to start to shift attitudes and beliefs. Now, these attitudes and beliefs are about certain behaviors. So while our values aren't tied to a specific behavior, our attitudes and our beliefs are. So I might have specific attitudes and beliefs about wearing a seatbelt. So in our work, in changing behavior, it's all about changing people's attitudes and beliefs about the specific behavior, right? If we want to change behavior, we've got to look back in this behavior model and we've got to start to think about leveraging the shared values that exist to start to shift attitudes and beliefs about specific behaviors. Therefore, we really want to understand what people's attitudes and beliefs are before we begin our work. Really asking ourselves, where, do we need to shift these attitudes and beliefs to move us to where we want to go? And if these values, attitudes, and beliefs become so important in changing behavior, then we need to ask, well, where do they come from? Right? If they become so important in our work, where are they coming from? Well, I think as you start to think about it, we can see that they come from a variety of sources, right? How we're raised. We get, our values, attitudes, and beliefs from our families, from our peers, from the schools that we belong to, or the organizations that we work for, perhaps our faith communities, media, laws, enforcement of those laws. So, what I'm trying to draw out here is that we can really start to see that they're coming from our culture. They're coming from our culture. And this is our definition of culture that we use at the center. We don't claim that it is the only definition. We don't even claim that it's the best definition, but it does work really well for the research that we do at the center. So it's the shared values, attitudes, and beliefs of a group of people that influence behaviors. And I'll read that again. It's the shared values, attitudes, and beliefs of a group of people that influence behaviors. So some key words here. Shared, first one is shared. And it isn't that every single person in this group of people has these attitudes and the beliefs, but we would say that most do. And this is about a group of people. And of course, we can identify, a variety of different groups, right? Groups identify themselves in a number of different ways. It could be a community, it could be a county, it could be our whole country, of course, is a group of people, but it also could be an age group or a demographic group or an ethnic population, right? So our work is to really better understand the current culture, specifically the shared values, attitudes, and beliefs that exist for the behaviors that we're addressing within that group. So our work really becomes more focused, I would say, on growing the shared values, attitudes, and beliefs that lead to safer behaviors, ultimately improving health, improving safety. So the core idea here is that changing behavior requires changing attitudes and beliefs. Values are hard to change and they're slow to shift, but they're often very protective. So we really want to leverage those values and then seek to shift. Our work really becomes shifting those attitudes and beliefs so that we can change behavior. I think it's a really good thing for us to check in on. Let's look at the strategies and the programs that you're implementing. If they don't change beliefs and attitudes, then maybe why are we doing them? We often ask the question, are we busy or are we effective? I would think that if we're engaging in strategies that aren't working to shift attitudes and beliefs, we might be more busy than we are effective. And so we really do want to check in on that. So I'm going to ask you another poll question now. Give me a second while I pull it up. The second poll asks, do you see your efforts to improve health and safety, any effort that you're working on to improve health and safety, as growing a culture? It might be new for you to think this way. So do you see your work at improving health and safety as growing a culture. Let's see, a couple more people still to respond. So I'll give you one more chance here. Go ahead and push submit if you haven't already. All right, let's see what folks say. Let's apply those poll results. Looks like most, like 73% of us saying, yeah, that our work really is about working to grow a culture as a way to improve health and safety. And I'm happy to hear this. This is exciting to me because I think that this can really help us be more effective in all of our work. So maybe it's something to consider. How might working to grow a culture help us improve our efforts if that's not something that we're currently doing? And it's important for us to recognize that individuals are really just the tip of the iceberg, right? That we're definitely part of something bigger, part of a more complex, social ecological system that surrounds us. I think too many times we can get into a place where we're only thinking about the individual and we're really not seeing all that exists below the surface of the water, like this iceberg, right? We tend to focus in on how we're going to get drivers not to drive distracted, or how am I going to get young people not to drink? And these are important questions, but they sort of hold us in that individual frame. When we start to do this, I think we can find ourselves sometimes blaming an individual. Sometimes we can stigmatize individuals. And I think all of us really need to recognize that individuals have so many issues surrounding them, right, under the water, so to speak, that we can't see. So many different factors that impact the decisions that they're making. And we sort of operationalize this idea in a very simple graphic of the social ecology. It's essentially saying that individuals exist within a series of nested relationships, a series of nested sort of social influences around them. And Yuri Bronfenbrenner first developed this model years ago to help explain how kids learn. But it has a really large, sort of more broad application in public health. We know that individuals learn from and are influenced by their families and their peers. This family and peer group influences what we believe and how we behave. And the same is true for the schools that we belong to, right? Or the organizations that we work for. We also learn from our community's norms and laws, and how those laws are enforced. So now it's not just enough that it's not only also, I will say, that we learn from these social layers around us, but we can influence them as well, right? We have an influence and an impact on our family and our peers, and on our organizations and on our community as well. So it's not just that they influence us, but we influence them. These nested layers of influence really kind of have a ripple effect. When you start to create change in one area, change kind of ripples throughout the others as well. And I think the simple little model here of the social ecology gives us some important insights on how these social layers, which I'd consider a way of organizing our culture, influences us, and then how we can also influence our culture. And we would say taking a cultural approach to our work is really when we're starting to engage in strategies at each of these different levels. And we'll start to get into that in just a few minutes. I also think if we've been in prevention long enough, or we've been in public health long enough, we can start to see that in the early days of prevention, and especially I would say the misuse of substances, there was a really heavy focus on individual programs. And individual programs are important, I will say that. But it was almost like if we could just inoculate the students with a certain program in the ninth grade, right? They'd be good, and we'd be done. But now we get that that's not really sufficient. If these teens grow up in an environment where risky behaviors are more prevalent around them, they're still likely to adopt those risky behaviors. We've also recognized that there's significant influence on policy, right? Like laws and workplace rules. And this is not to say that individual programs are not important and that laws and policies is where we need to focus all of our attention. No, it's not. It's about having strategies at each of these levels. So again, when we start to have strategies at each of these different layers, this is what we would start to say is taking a cultural approach. Our work is really to have different layers across the social ecology that align with and reinforce one another. This is how we can sustain our efforts. Because if our attitudes and our beliefs are part of the culture, they're much more likely to be sustained and passed down generation to generation. So, again, a goal might be working towards, because it's hard to do all at once, right? Working towards having strategies on our issue at each of these levels of the social ecology. And I'll give you an example in just a minute of what that might look like. So this really sort of transforms our thinking. Before we might have asked, how do I get individuals to wear seatbelts? But now by asking, what actions do I want to grow across the social ecology to increase seatbelt use, we've fundamentally transformed our approach. We've really broadened our approach. It forces us to stop looking for that one magic strategy, right? That one silver bullet. We know that there is not a silver bullet solution to any of the issues that we're working on. These are really complex social issues, and there isn't one thing that we're ever going to find that's going to effectively address the issue, right? Multiple strategies across the social ecology can really embed health and safety throughout the culture. And that leads me to the third sort of core idea here, that a cultural approach requires thinking across the social ecology. We can't just think in that individual frame or even just in that policy frame. It's really about all of these different layers. And it absolutely can seem overwhelming, but that's the ultimate goal, right? When we take it in smaller steps, we start thinking about strategies within one of the layers and then start to work maybe with family groups and then with organizations in the community. So I did say I wanted to share with you an example of what this might look like in practice. And this example on the screen here is is from a project that we're working on in Utah. We've been working on many years in Utah to increase seatbelt use in 9 rural counties in Utah. And they're taking a cultural approach to the issue. So rather than just focusing in on how do I get individuals to wear a seatbelt, how do I just tell people to wear a seatbelt, it's really looking at this differently. For individuals, it's really about increasing their capacity and their skills and their comfort and confidence in asking others to wear a seatbelt, knowing that we tend to pay attention to and are influenced by those we trust around us. So building the capacity of people to ask their loved ones to wear the seatbelt. It's about having family rules and enforcing those family rules, being consistent about those family rules around seatbelts. For schools, it's about engaging in education and also bystander engagement on the issue. For workplace, it's seeing if work sites have seatbelt policies. And is it more than just putting that seatbelt policy in the orientation manual, but is it reminding employees about the seatbelt policy? Is it training on the policy? Is it reinforcing and enforcing that policy? For key leaders in the community, it's about helping them build the capacity of them to advocate for strong policies on seatbelts, to engage on the issue, right? Giving them tools and talking points to encourage seatbelt use and to encourage residents to ask others to wear a seatbelt. And for law enforcement, it's really about encouraging law enforcement officers to always wear their seatbelt. We were seeing that there were lower rates of engagement in seatbelt use among some law enforcement agencies. We really wanted to boost seatbelt use among officers, but also having them consistently enforce the primary seatbelt law and also advocate for the issue. And this didn't happen overnight. This happens over many years and building the tools to support engaging in these behaviors across the social ecology. But the goal is you can really see that there's a difference here. It's more than just telling people to wear a seatbelt. It's about what are the actions I'm working on growing across a social ecology to increase seatbelt use. And I think when we embrace sort of that need to have strategies across the social ecology, we recognize that the solutions are in the community. It's not that we're coming in and telling the community what's wrong with them and what they need to fix, but it's about that, the solutions exist within their community, within their social ecology, and that by growing solutions and positive protective behaviors across the social ecology, this is where we can really embed health and safety in the community. And this is where it becomes sustained over time because all of these different layers are influencing one another. So now we've talked about what a framework is. We've talked about what we mean by culture very briefly, and we could have a much longer discussion on culture, but we're just really trying to set the context here for how we approach the work. So now let's talk briefly about how we intentionally focus on the positive and sort of why it's called the positive culture framework. Right. So many of you have probably seen all of the research in the past decades about the value of an appreciative lens, right? About a hope-based lens or a strength-based or asset-based approach. Um, we agree with that. Growing protective strategies is often more effective than simply focusing in on the risks or what we want people not to do. We at the Center for Health and Safety Culture intentionally avoid fear based strategies. Fear can be popular with groups, but it does have unintended consequences that can actually make things worse. It can increase stigma, it can really polarize communities and shut down constructive dialogue. And we absolutely want to have constructive dialogue and we want to bridge gaps in communities rather than polarize communities. So, focusing in on what we want to grow provides guidance on what to do as opposed to what not to do. So, an example this could be if we go back to our impaired driving example, rather than saying, well, just don't do it, we could talk about what we do want them to do, right? We want them to plan before drinking, maybe assign designated drivers before they leave. What are those behaviors we want to grow to reduce impaired driving? Really, that's an intentional flip to what we want to grow rather than what only looking at what we want to reduce or eliminate. And we recognize that the issues that we're all addressing are incredibly complex. Absolutely, they are. We talk in the training about technical versus adaptive challenges and how the issues that we're working on are really adaptive challenges and how that requires a different type of approach to find solutions. So, knowing that we're working on these very difficult issues, we could probably use a little bit more energy to move forward, to keep going, right? Using an appreciative lens or a strength based approach can really help give us a little energy in the difficult work that we're all engaged in. And it sort of brings me to another idea here about hope. This is one definition of hope. There's actually quite a bit of research around hope and using a hope based frame. Hope is the perceived capability to derive pathways to desired goals and motivate oneself via agency thinking to use those pathways. And there's two really important pieces that I want to pull out here. There's the willingness to move forward, right? We need that willingness, that motivation, that energy to move forward, or the will. And we also need to see a path forward, the way. Those are two really important parts here. The will and the way, both are critical in our efforts. When people do not have a will and a way to move forward, they get stuck and they can get hopeless. And I think often in efforts, we can work to raise concern, right? Which is important. Raising concern is important to foster awareness, to increase engagement on the issue. But raising concern is not enough. We also need to raise hope so that people can see that path forward. If we're only raising concern, people can get stuck or they can feel stuck. They can now know that they want to do something because they're concerned, but they don't see that path forward. So hope becomes really, really important in the work that we do. Humiliation, shame, guilt, and angst are not the primary engines of change. Ironically, such experiences can even immobilize the person, rendering change even more remote. I think that's a really important quote. We need to look for this in our efforts. We need to be sure that we're not intentionally creating shame. And I think we need to, and we can test for this in our work. It can be like shame, humiliation, that can be a negative consequence of our prevention efforts. So we really want to explore that and work hard to avoid that in any way that we can. Again, our work is difficult and we want to be sure that we're not making it harder by creating humiliation, shame, guilt, and angst, which moves people in the opposite direction. Behavior change is hard. Let's not make it any harder. So our core assumption in the work that we do at the Center for Health and Safety Culture is that the positive exists and it's worth growing. And this goes back to our earlier slide where I said the solutions were in the community. Our assumption is that there is positive in the communities and the organizations that we work with. And it's our goal to grow that, to identify what is working, right? What are those positive, protective attitudes and beliefs and behaviors that exist, and then work to grow that over time. And it's from there that we really find the solutions. This is so important, I think, especially in working with a cultural approach. I think we need to find what's good and healthy and positive in cultures and not use culture to beat people up. And I think it's within this goodness, which is really worth growing. So the core idea here becoming choosing a positive, appreciative lens is important, right? This is fundamental in our prevention work. When we tie all of this together, right, we talked about positive, we've talked about culture, we've talked about a framework now. You can see the words coming together into the positive culture framework. This is just a graphic, a simple graphic of our framework. The left-hand side has a bit more about the process for doing the work, where we engage in the work, which is across the social ecology, and then key skills, leadership, communication, and integration, which I'll go through each of these aspects here. But I do want to start on the right-hand side of the model here, this green arrow, which is our goal or our outcomes. So focusing in on the right-hand side, the green arrow, this frames how we engage in the work. I think we need to be sure to label our efforts as those to improve health and safety. I think this is often a shared universal value, but one that we still want to intentionally call out to bring people together around the issue. We're looking to improve health and safety. We're working to grow something. Next, we're going to do this by increasing protective behaviors and decreasing risk behaviors across the social ecology. Again, this is sort of getting out of that individual focus, that one layer of the social ecology. Rather, we're working across these influential layers. And how do we do that? Well, by growing cultural factors across the social ecology. That's at the base of this green arrow here. These are the shared values, attitudes, and beliefs that influence the behaviors that we're seeking to address, right? So what are those values, attitudes, and beliefs about underage drinking, right? That we want to address so that we can increase protective behaviors to improve health and safety. We'll need to prioritize those key cultural factors so we can really focus our intention. And this is a core strategy of our work. This is where our strategies come in, right? Our strategy work is to grow or to improve these cultural factors. Our strategies are about changing attitudes and beliefs about the particular behaviors that we're working to address. So how do we do that, right? How do we improve health and safety by increasing protective behaviors and reducing risk behaviors? Well, that's where the left-hand side of the framework comes in. Oops, sorry. I wasn't clicking through, but that's where the left-hand side of our framework comes in, which is a 7-step process that is sort of outlined here in blue. Now, one thing I will say is that these steps are meant to be done in order, but I do see that once you've been doing this for a while, you might start to be noticing that you're engaged in a couple of steps at a time, and I think that's okay, but the order is important. These steps are intentionally arranged in a circle. It is a cycle. We're going to continue to engage in this process because we're really never completely done improving health and safety. Our issues might change, our audience might change, but we're sort of always working to improve health or to improve safety within our communities. So these steps, I would assume, look pretty familiar to other strategic planning processes that you work with, right? It absolutely looks similar to other processes. That's because we've studied a lot of other models and these steps hold up really well. We've added a bit more depth here as we felt that a couple of steps were really missing from other processes that we've looked at. So let's just kind of start briefly going through each of these steps. And again, I'll just do this at a very high level just so that you can see what they are. The first step is to plan and advocate. Here we are intentionally engaging in planning and advocacy work. We're going to raise concern about the issue to increase engagement. We also want to raise hope to provide people that needed path forward. Here in step one, we're also gathering and building the capacity of our stakeholders, right? This could be a work group at an organization. This could be our community's coalition. We're looking at what available resources we have and maybe a plan to secure additional resources or funding. In step one, we're also developing our timelines. We're also developing our evaluation plan, right? So, because we're going to evaluate it every step along the way. Step two is all about assessment. Here's where we're assessing the culture. This might be about gathering existing data that you have. This might be gathering your own data that might be unique, that doesn't already exist. But we really, in this step, in assessing culture, we really want to understand what are those shared values, attitudes, and beliefs and behaviors that exist. This is important because we may have data. I find this in a lot of communities that I work with. We may find data on how prevalent the behavior is, but we often don't have data on attitudes and beliefs about the behavior. And that's important because that's where our work really needs to be, about shifting those attitudes and beliefs so we can see if we're about to shift behavior. Another important aspect of step two of assessing the culture is determining and sort of mapping out what's already taking place to address the issue so that you have a good understanding of what strategies exist, maybe what's missing, where there's duplication in strategies. So that's a good form of assessment too. In step three, when we're going to want to establish a common purpose and prioritize our opportunities. We're making meaning of the data that we've collected in step two. We are looking at what opportunities are most important to begin with. This could involve some readiness issues, right? What are we most ready to tackle now? What's most important to address now, and who's ready to do it? We're going to leave step three with a primary issue of focus. We're going to know sort of what cultural factors we're going to focus in on so that we can move into step four, looking at strategies to address those cultural factors. Again, those shared values, attitudes, and beliefs. Another important aspect of step three here that I want to point out is developing a common frame. Ultimately, it's identifying what's in our green arrow. What are we working towards? What are we working to grow? It's that intentional flip to sort of that positive mindset, that protective sort of asset-based approach. In step four, we're going to plan our portfolio of strategies, really recognizing that it's going to require multiple strategies across the social ecology to be effective. Again, there's no magic solution. There's no silver bullet that's going to fix the issue. It's really a bit more, as my colleague would say, a silver buckshot across the social ecology. In step five, we're going to pilot test our strategies with a subset of the population. We're going to want to learn how that strategy is being implemented and if any small tweaks or changes need to be made before we go into full deployment, which is step six, which is implementation of our strategies. We'll want to be sure here that our team or our coalition or our stakeholders are prepared to listen to the conversations that arise from our strategies and are prepared on how to guide those conversations. Without a doubt, if you're implementing a strategy of any kind, it's going to create some sort of conversation, either within the focus audience or within others around the audience, even within your coalition. You want to be prepared to navigate that conversation and not sort of leave it hanging with unanswered questions. So you really want to prepare for this and before implementing strategies. And then step seven is where we'll evaluate our effectiveness and determine our needs before we re-enter this cycle again. Again, we've planned that evaluation in step one, and we think about it at every step and make minor adjustments as we can to sort of increase our effectiveness at every step along the way. So that's a bit about the 7-step process. I now want to shift a bit and talk about the skills. These skills are outlined in green around the 7-step process. Leadership skills of the people engaged in the work have a really profound outcome in the work, right? The leader's capacity has a profound impact on the outcomes. Are we investing resources into building our prevention leaders? Are we building the capacity to lead across the social ecology, to cultivate transformation? Leading prevention work is not easy. You're probably aware of this. You've come up against this in your work. We find that in our work that trying to shift beliefs can lead to people pushing back on us, right? We've disrupted their assumptions and they can push back a bit. Are we growing leaders that can navigate these sometimes challenging but critically important conversations? Next is communication. Communication is absolutely critical. We have to use communication in every single strategy that we're about to engage in. So we really need to build our skills here, especially I would say when we're trying to shift attitudes and beliefs. We can unintentionally communicate and create misperceptions, and we want to work hard to avoid this. Our team has studied this a lot. Sometimes our communications can create, in prevention in general, right? Our communications can create misperceptions such as, oh, everyone's doing it, when we're sort of in that mindset of growing concern around the issue. And we want to avoid this. We really want to plan our communications and have a strong theoretical framework for our communications before we go out and broadly communicate to our communities. And the third skill is integration. And this is a tough one, but it's really critical. This is where we're thinking about those strategies across the social ecology. We're looking at how these strategies can align with one another and support one another and be sure that they're not contradicting one another. Do we have a strategy going on with students here and maybe a strategy going on with parents, but they're saying completely different things? Like that would be, or at least contradicting each other. We would want to be careful about that. So this is really this integration of our strategies is an important aspect of the work at the community level. So we talked about the process, we talked about the skills. Now I want to talk about the context or where we do the work, which is across the social ecology. As an example, if we're looking at, like we've talked about a couple of examples before, like if we want to look at distracted driving, we'll want to look at the individuals, yes, their parents and their families, their schools, their organizations, right? What are our community's policies? What are our organizational policies and how are those enforced? It's a really our portfolio of strategies that encompasses all of these different levels. So when we're looking at the process too, we're thinking about planning and advocating across each of these levels of the social ecology. We're assessing the culture across these different levels of the social ecology. That's why we embedded it into the middle of the framework. So that was a very quick overview of the framework or way of organizing our work to improve health, to improve safety. Of course, there is a lot more detail in each of these components of the framework. And that's really what the training is for, right? So this is an overview of the framework. And if you are engaged in a training with us, we get into more specifics, of course, on each one of those things. What I do want to do next is share with you, I'm going to pop over a couple of slides here. I do want to go back to sort of our agenda here, kind of what were we focused in on? We talked about a framework as a way of organizing our prevention efforts. We talked about culture and growing the shared attitudes, values, attitudes, and beliefs of a group of people that influences behaviors and how growing a protective, positive culture can help us improve health and safety. We talked about the importance of appreciative, strength-based, positive approach. And then I introduced the framework at a high level. I do want to review briefly here those core concepts that I highlighted earlier. The first one is about thinking about content and process. Both are important, but I just don't want us to focus only on the content, whatever our issue is. It's mental health, it's reducing stigma, it's underage drinking. Those are all incredibly important, and thinking about a process can help us be effective as well. A process, a framework. Changing behavior requires changing beliefs and attitudes, right? We looked at that simplified behavior model. A cultural approach requires thinking across those different layers of the social ecology. And finally, choosing a positive appreciative frame is important. So I do know how quick this overview was and how little details in each section I was able to provide, but I did want to make you aware that we do have an upcoming training. Our next training will be our next sort of in-person, open to anyone training is going to be in Charlotte, North Carolina on March 28th through 30th. Just so that you're interested, you can absolutely check out details on our website. Here you'll be engaged with other leaders across the country doing similar efforts as you. So we often have a good mix of folks in the room, from prevention specialists to public health leaders to law enforcement, coalition members, school districts, all looking to learn more about the framework to improve health and safety in their realm. It's always a good cross section of different topic areas in the room, and it's just a really great way to learn more, but also to engage with others that are using the framework. So you can register now on our website. But I also did want to make you aware that there is an early bird discount right now that goes on through December 16th. So you've got a month from today to still check out that discounted rate and register there. Now, I if you're interested in training but you're unable to make that in-person training in Charlotte, we do have other training opportunities available. We can provide on-site training. So if you're like, boy, I want my whole coalition trained, great. We do that all of the time. So that could be a hosted training that we come to you and deliver that training either in person or virtual. We can do that way too. So we can do that on the positive culture framework. We can do that specifically on any of the 3 skills. So maybe you're looking for a communication training. We can, do a 1, 2, or 3 day training on communication. Also, specifically social norms, marketing communication. We can do specific training on that as well. Leadership skills, integration skills. We also have guide service available. Once you've gone through a training, you are eligible to have guide service, meaning that if you leave a training and you're anything like me and you're like, that was a great training. Now, how do I implement that once I go back? That's where I work with you sort of one-on-one to continue the work in your community. So like, how do I do step 1? How do I do step 2? We walk through that together. We do assessments, we do surveys. So if you're looking to better understand what is the culture, what are those shared values, attitudes, and beliefs around the issue that we're working on, we can certainly help you with assessments and surveys and also evaluation to do that. And then free webinars. You're on one today, and we certainly do these regularly. So please do check those out. We do record all of them and put them on our YouTube channel if you want to listen again or if you want to share that with your colleagues. So with that, I will say thank you for joining us today. I'm just going to leave this screen up here for a bit in case you do need to contact us about anything. All of our contact information is here. You are welcome to email us or to give us a call as well. But I am going to hang out here for just a few minutes here in case folks do have questions. So I want to I'll pull up because for some reason I don't have a chat window anymore. There it is. Anyone have questions, comments on what I covered about the framework? And feel free to either write that in the chat window or the Q&A window, and you can also just come off mute if you'd like, and you can ask them verbally as well. Oh, Lily, you're coming. I was just gonna say, I'm not reading where you're all coming from. Lily, hey, I was just gonna say, I love my friends in Rhode Island and tell Kathy I say hi too. I'll look forward to seeing you in Charlotte. That's awesome. And Savannah, hey, Wendy and Savannah, we did a recent training, or not recent, but like 2 years ago, just before the pandemic, we were in Savannah for a training. That's one of my favorite cities. And Wendy, you're going to be in Charlotte as well. Awesome. That's great. Good. I'll look forward to I'm in Charlotte right now, so I'll be looking forward to seeing you here. So if there are any questions as you listen to today and you're curious about like what's going to be happening in Charlotte or anything else about training, I'm certainly happy to help you there. All right. I am not seeing any questions coming in, so I will say thank you all to those that joined us today. I hope you enjoy the rest of your day, the rest of your week, and I hope to see you in Charlotte. If not, I hope that we can connect soon. Thanks for all the work that you do in your local communities and in your states. Bye, everyone.